As is the case every winter, the NHS is in crisis. The lowest number of patients ever are being seen within 4 hours of arriving at hospital, and today hospital chiefs have warned that this could be a watershed moment for healthcare. But this isn't just about statistics, targets or sound bites, this is people's lives. There are reports of people dying while queuing in ambulances to get into hospital or while queuing to get into resus for the urgent care they need. And who has to deal with this crisis on the front line? Not the government ministers who've cut the funding, and not the bosses of the private companies who've sucked so much money out of our NHS. Instead, it's overworked, underpaid NHS staff. Doctors and nurses have spoken about people being in tears at the end of their shift because they know they haven't been able to deliver the best quality care, and of the constant fear that they may miss something that leads to the worst possible outcome. We have to act. On the 3rd of February, a major demonstration has been called in London and protests elsewhere around the country, demanding solutions to save our health service. That's been initiated by the Health Campaigns Together group, which last year gathered 250,000 people on a similar demonstration in London. We all need to get behind those events and spend the next few weeks building for the biggest turnout possible. And that should be just the start of a huge movement. The trade unions, particularly the ones who organise health workers, need to step up and place themselves central to that movement. In 2016, working class people rallied around junior doctors when they took strike action against a new, unsafe, unfair contract. Last year, low-paid porters and domestic staff at Barts Trust hospitals in East London took the same kind of action, demanding a very small pay increase. Those workers showed that when the trade unions give a lead and there's a serious campaign, the health workers will be willing to take strike action in defence of their jobs and conditions, as well as a service for all of us. And Corbyn's Labour should throw itself into this movement too, including by boldly backing workers when they do take action. The General Election Manifesto was hugely popular, exactly because it did put forward policies such as defending the NHS from cuts and privatisation. A mass, united movement can win the NHS that workers and patients deserve, as well as bringing down this Tory government in the process.